Listen to bronchial breath sounds. These characteristically loud, high-pitched bronchial breath sounds resemble the sound of air blowing through a hollow pipe. Their expiratory phase is louder and longer than their inspiratory phase. They are present normally only over the manubrium, and there is a distinct pause between the inspiratory and expiratory phases. The appearance of bronchial breath sounds over the periphery of the lung may mean abnormal sound transmission because of consolidated lung tissue, as in pneumonia.